Good morning, everyone. It's an honor to deliver this keynote address titled Brain and Body Foundation, a Decade of Impact, Scaling Solutions for Medically Fragile Children. Today, we celebrate a remarkable milestone, 10 years of Brain and Body Foundation. Today, we mark not just the passage of time, but a decade of vision, innovation, and life-changing impact. What's the vision? 10 years ago, under the leadership of Dr. David Ajibade, the Brain and Body Foundation, which I refer to as BBF in my address, was founded on a simple yet bold belief that every child, regardless of circumstance, deserves not just to survive, but to thrive. The focus of BBF is on medically fragile children, those living with sickle cell disease and other serious chronic conditions like neurological disorders. These children whose lives depend on specialized care, medical interventions, and constant support definitely need to be impacted positively. BBF has stepped in to provide more than just sympathy. It provides solution-based, science-based, nutrient-driven, and people-centered solutions. BBF is at the heart of this work, and their focus areas are CARE, that's their framework: charity, advocacy, research, and education. In the area of charity, they have delivered free clinics across 14 states, providing supplements and consultations to over 6,000 medically fragile children. Through Project SCD Nigeria, they enrolled 5,000 children in just 18 months, distributing 25,000 bottles of Citamil, that's a blend of vitamin C, D3, and zinc, thereby reducing crises and saving lives. In the area of advocacy, they've worked with the Federal Ministry of Health and other partners to shine spotlight on sickle cell disease and brain health, influencing policy and amplifying the voices of affected families. In the area of research, they have pioneered studies such as the role of vitamin D3 in sickle cell management, showing how low-cost interventions can transform outcomes for thousands of children. Through seminars and award-winning TV show, Your Health in Your Hands, they've empowered parents and health workers to manage crises, prevent strokes, and promote long-term wellness of these children. So what has this vision achieved? Apart from all these that I've mentioned, they've been able to directly support 6,000 children. These children have reported fewer hospital visits and restored hope. Behind these numbers, there are stories: children smiling again, parents breathing easier, and the communities uplifted. Yet, the work is not over. It's just the beginning. We know that each year, 150,000 Nigerian children are born with sickle cell disease, and countless more face neurological disorders. The mission for the next decade is clear. There's need to scale up proven solutions, to expand the clinics and outreach into underserved communities, and to strengthen partnerships so that no child is left behind. Scaling up is not just a vision. We know that it requires funds, resources, partnerships, and commitment. So there's a call to action, and you are all invited to be part of it. Support the free clinics. You know, in Nigeria, very low percentage have any form of health insurance. Invest in the research going on and partner with BBF to take these life-saving programs nationwide. Together, we can turn despair into hope and fragility into resilience. As we celebrate this decade of impact, let us remember every bottle given, every consultation offered, every child whose pain is eased. These are not just statistics, they are lives and futures reclaimed. So, BBF is more than an organization. It's a movement of compassion, of science and action. As we look to the future, we do so with one conviction: the best is yet to come for BBF. Thank you. God bless you. God bless BBF. God bless Nigeria.